Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Jason Griffin. He's a healthcare executive. Today's Kevin MD article is The Digital Divide in Rural Healthcare. Jason, welcome to the show.
Thank you, Kevin. Thank you for having me.
All right. So before we get into your article, just briefly share your story and journey.
Yeah, so I've been working now in healthcare IT for almost 28 years and been in consulting for most of that time. I've been a CISO in an organization and also worked in a lot of different healthcare organizations. I've always had an affinity for rural healthcare just because of some family background and my mom's side of the family was from. And so over the last 15 years or so, I've really dived into helping to create solutions and collaborations to really drive home more of and close the digital divide amongst those organizations that just grew exponentially over the last 15 years or so.
All right. And you talk more about that in your Kevin MD article, The Digital Divide in Rural Healthcare. Now, for those who didn't get a chance to read your article, just tell us a little bit about the context and then the article itself.
Yeah, so that digital divide has come in about since just really the modernization of IT and infrastructure has grown so dramatically in the growth of EHRs over the years and the lack of financial availability of those systems to rural hospitals. There's a workforce gap that's grown constantly. There's hard to recruit in those areas, and it's just created an environment to where those folks in those organizations have such a big heart, and they do it for the love of patients, for the love of caring for individuals, but they wear so many hats that it's oftentimes they're stretched so thin that it's wearing them out. It's wearing out the organization, and the care model has not kept up with in terms of integration and collaboration among systems, as we've seen in the larger IDNs. And so that divide has really just created and grown dramatically. And you couple that with the fact that they're operating on such low margins, they don't have the capital to invest in that infrastructure. Vendors aren't really supplying solutions to fit that financial environment. And it's heartbreaking at times, quite frankly. I can remember having to sit in the car and drive an hour and a half, 2 hours, just so my grandparents can get care when I was young. And so that has grown immensely since then.
Give us a picture of the types of settings and healthcare institutions you're talking about that really illustrates some of those rural health IT shortcomings that you mentioned.
So, you just picture the fact that you have rural America exists. I mean, we think about the East Coast, the West Coast, but when you talk about the middle of America, most often there's one hospital within a 200-mile radius of a lot of folks living here in the U.S. Those hospitals operate on 44% of more of them operate on negative margin. The folks that work there are longtime residents of that region most often, and their families are, so they know the patients, they know the people, but technology just does not get there. For instance, just the basic Wi-Fi access just does not get there. And so, we've seen a little bit of that close with some of the satellite opportunities that come into the area. But just got to imagine being somewhere where you are so many miles away from specialists, from true care that most of us need, cancer care. I mean, how far do we have to go just for that? And so, the setting becomes one that will break your heart because of what you see, but that will give you faith in humanity because of the people that are in those organizations and how much they care and what's driving them to do better with less.
You wrote in your article that sometimes weather events, a simple snowstorm, can sometimes knock out health IT for one of these rural health facilities and really cripple that organization, right?
Right. Oh, right. It was tornadoes in rural Arkansas where my family was from. But just think about, a snowstorm where now power lines are down, water's down, hospitals, generators don't function for more than a couple days. If they have generators, patients aren't able to be moved because of the distance from one hospital to the next. And do they even have the transportation to get them there and to move those folks there? And so it becomes, just in that sense. And even with that, glad you mentioned that. I mean, with the way we're seeing weather patterns change over the last 15 years, it's just become even more of a gap. I'm happy we have been involved with the Rural Health Community nonprofit that we've partnered with Microsoft and CDW, and we're now able to provide through Starlink, access to Wi-Fi to at least start to close that gap. And so I'm just excited about where we can go. And I think there's the collaboration, community collaboration, vendor collaboration, public sector, private sector is starting to grow, and we're starting to see more involvement. And so I'm hopeful that even with the investment coming from the rural health program, that's transformation program, that hopefully will start funding next year, we can start to improve and modernize the way we deliver care so that becomes more sustainable in a rural hospital over the next 10 years. And it's not just about dumping money, it's about changing and collaborating and integrating.
One of the things you mentioned earlier was how difficult it was for recruiting and bringing health IT experts into rural healthcare areas. So you're getting situations, as you wrote in your article, that one person may act as the CIO and the IT director simultaneously. And during things like downtimes and health IT crisis, just tell us about the workforce restraint that really impedes the recovery of anything that happens to the health IT infrastructure in rural areas.
Yeah, you're single threaded. Imagine that CIO and that CISO, his or her family is also in that area dealing with whatever downtime, and can he or she even get to their office? It's a scenario where you have 1 to 2 individuals that you're going to have to rely on to be the recovery team, not only the incident response team, but the recovery team, ensuring that the continuity of the organization continues. And that's just it's and every day, and remember, they're already operating on negative margins, and every day that they're down, that loss of revenue is it's you can't recover that. And so that's just lost revenue for that organization. And those folks we have plans, there are plans in place. There's some folks doing, they're Superman and Superwoman, and they're going to come through. But how often that's not sustainable? How often can we go through that level of of return from those 1 to 2 individuals?
Yeah.
And that's what's concerning. And I hope that's what we fix going forward.
So you briefly alluded to some potential solutions going forward. You mentioned
Mhm.
Starlink and other satellite-based technological solutions. So go more into detail in terms of what kind of options we have to help that rural IT infrastructure.
Well, I think Starlink was a great start, and we're looking now to go forward with, and Microsoft kicked this off last year in conjunction with the White House and some other areas where they were offering free security assessments, free security tools. Starlink stepped up to do the same. We as Nordic we're looking at solutions that are going to meet the market where we need to meet them in terms of financial capabilities and the price points and delivery models. Our whole goal is to not just upgrade infrastructure, but upgrade the ability and the integration of how that care is delivered. Sometimes it may not need to be infrastructure. Sometimes we can just look at a collaboration of data and the sharing of data in a different way that allows that. But for us, there are going to be tools around disaster recovery and business continuity. I think we're bringing the cybersecurity tools and managing partners and third-party risk management. Infrastructure modernization is something we're looking at. How do we improve the the access to the EHR and to data and put it in the right place at the right time? Telehealth is going to be huge.
Mhm.
Just being able to, remotely manage and see those patients, and not always require those patients to have to drive that 100 miles to come to a hospital. If we can get the infrastructure in place to support that, then those programs will in and of itself help us move the needle in terms of the level of support available to those areas.
And just contrast what you're talking about with a traditional vendor relationship.
So, traditional vendor relationship is, most vendors build their solutions at a scale that is, for the larger IDN type of hospitals and environments. Those hospitals are able and can afford and have the budget to spend those dollars, but they don't, that's not always, obviously it's not the case. And so what we're looking to do, and it's not those vendors' fault. I mean, they're obviously they're revenue generating businesses and organizations. It's and they have a model for their solution. But we want to, try to identify ways to just bring that down to a price point and have vendors support us in that just to relieve some of that pressure, that financial pressure on those organizations.
So tell us in terms of going forward, you mentioned that rural hospitals are already working on negative margins. What
Mhm.
other solutions do we have, maybe from a policy standpoint, that can help these rural healthcare facilities going forward, especially from a health IT standpoint? And there's just so many aspects to that. And we mentioned a few today, and you threw in, of course, cybersecurity as well. So tell us from a policy standpoint, what more can we do to help these rural clinicians?
Oh wow, we can really create more of a collaboration amongst private sector, public sector, start to share data more in our health, in our HIEs, our health information exchange, create a robust infrastructure for organizations to share that data. Our revenue cycle process for those, I mean, think about, operating on AR days where if you're getting paid, if the claim is accepted, it may be 90 to 120 days before you receive payment and the cuts in Medicaid could affect that we're seeing possibly come in the next 5 years or so, and how those are going to be affected. And so there's not one silver bullet that's going to fix all of this. It's going to be a collaboration amongst many types of organizations and entities. We've got to fix the revenue cycle piece. We've got to modernize the care model. We've got to integrate these systems and data and put data in the clinician's hands at the right time. So often, because we have disparate systems, we end up forcing the clinician to be the integration point, and they end up having to manage multiple systems and multiple types levels of data, and it's just inefficient. And so if we can help to solve that problem and create solutions, realizing those solutions aren't multi-billion dollar generating type solutions. However, they are solutions that's going to, one, improve the overall health of our population,
Mhm.
which in turn takes some of the strain off of our healthcare system and improves costs across the board for everyone.
We're talking to Jason Griffin. He's a healthcare executive. Today's Kevin MD article is The Digital Divide in Rural Healthcare. Jason, let's end with some take home messages that you want to leave with the Kevin MD audience.
Oh, just be thankful for and recognize what's happening right now in healthcare. I implore people, everyone, just to be aware of what your state is doing. They've all made applications to be a part of the Rural Health Transformation Program. Talk to your congressmen and senators and really understand and be thankful for, if you're in those rural areas, those local hospitals, what those folks are up against and what they're doing. And that'll hopefully drive some of us to stay home and be a part of the fix, and not necessarily, when we go to school and go off, we go to the big city. But there's a lot of need and a lot of value in us supporting those smaller hospitals and growing there. So I would just say that, just be aware. Please, we need to bring more awareness to this, because we're headed down a path. If we don't change soon, it could be catastrophic for us. Too many of these hospitals are closing, and we want to stop that process.
Jason, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Kevin. Take care.